Bonjour à tous, bienvenue à cette conférence de presse. Aujourd'hui, le Premier ministre du Québec, M. François Legault, est accompagné du ministre de la Santé et des Services sociaux, M. Christian Dubé, et du directeur national de santé publique, Dr Horacio Arruda. Monsieur le Premier ministre, à vous la parole.
Bon. Bonsoir tout le monde. Peut-être avant de vous parler de la pandémie, je voudrais dire quelques mots sur ce qui est arrivé encore une fois à deux femmes, deux meurtres, chez nous. Ça n'a pas de bon sens. En 2021, j'ai le goût de parler aux hommes, d'homme à homme. Il n'y a rien de masculin, il n'y a rien de viril à être violent avec une femme. Au contraire, moi, je trouve ça lâche. Il est temps que les hommes, on se mette ensemble, puis qu'on se dise, on va parler à nos garçons, on va parler à nos chums, mais ça n'a pas de bon sens qu'en 2021, on vive comme des barbares. On est dans une société civilisée, puis toutes les femmes, puis tous nos enfants ont le droit à un milieu sécure. Donc, passons le mot et espérons que les mesures aussi qu'on met en place pour les centres d'hébergement pour les femmes, que la situation enfin s'améliore. Revenons maintenant à la pandémie. De manière générale, ce qu'on a vu au cours des dernières semaines, c'est qu'il y a eu une baisse, vous l'avez vu à chaque jour, une baisse importante du nombre de cas d'hospitalisation. Par contre, depuis une dizaine de jours, ça s'est stabilisé. Donc, au total, puis on le voit en particulier dans certaines régions, ça s'est stabilisé. Donc, il n'y a plus de baisse de cas et d'hospitalisation. Je pense que Christian et le docteur Arruda vous ont bien expliqué hier pourquoi, en particulier à cause de la présence de plus en plus importante du variant britannique. On peut prévoir, en tout cas c'est ce que les experts prévoient, c'est qu'on pourrait, surtout dans la grande région de Montréal, voir une augmentation des cas des hospitalisations dans les prochaines semaines. Bon, s'ajoute à ça la relâche scolaire. On ne sait pas encore jusqu'à quel point les consignes vont être respectées. Le bon côté, évidemment, c'est la vaccination qui approche, mais quand les experts de la santé publique mettent ça tout ensemble, ils voient que dans les prochaines semaines, bon, d'abord, quand on regarde les régions, il y a des régions, quand on regarde les hôpitaux, où on peut voir une certaine stabilité, puis il y a une petite marge de manœuvre. Mais il y a d'autres régions où il n'y a aucune marge de manœuvre, puis donc, si, puis il semble que c'est même pas un si, mais c'est plus quand il va y avoir une augmentation des hospitalisations dans ces régions-là, bien, on va se retrouver dans une situation qui est difficile. Donc, c'est en tenant compte de ce contexte qu'on a eu à prendre des décisions qui ne sont pas faciles. C'est pour ça que je vous annonce que lundi prochain, le 8 mars, les régions de la Capitale-Nationale, Chaudière-Appalaches, Mauricie, Estrie, Centre du Québec vont passer au palier orange. Donc, ces régions-là, ça veut dire que les gyms, les sports à deux, les salles de spectacle, les restaurants vont pouvoir rouvrir, donc dès lundi prochain jusqu'à 9 h le soir, puis le couvre-feu va passer à 9 h 30 le soir dans ces régions-là. Je rappelle que dans les zones oranges, les enfants qui sont avant la 5e année n'ont pas à porter de masque. Puis, on a fait aussi un accommodement. Dans toutes les zones oranges, le nombre de personnes maximum dans les lieux de culte va passer de 25 à 100. Donc, ça, c'est pour Québec, Capitale-Nationale, Chaudière-Appalaches, Mauricie, Estrie et Centre du Québec. Maintenant, pour ce qui est de Montréal, Laval, Montérégie, Lanaudière, Laurentides, la santé publique prévoit que dans les prochaines semaines, il va y avoir une augmentation des cas et des hospitalisations. Donc, on ne peut pas, dans cette situation-là, changer la couleur de ces zones. Donc, ces zones vont rester rouges par prudence. Par contre, on est en train d'examiner 3 sujets qui reviennent beaucoup. Entre autres, j'en parle avec beaucoup de nos députés. D'abord, le sport. Bon, vous dire, les gens qui me connaissent savent, je fais beaucoup de sport, j'aime le sport. Le sport, c'est important. Il n'y a rien de mieux pour faire baisser le stress. Le sport, c'est important pour la santé mentale. Mais on va tous convenir qu'il y a au moins certains sports où les rapprochements peuvent apporter une contagion. Donc, on a eu beaucoup de discussions avec la santé publique. La santé publique est d'accord qu'à partir du 15 mars, partout au Québec, on va pouvoir commencer le parascolaire. Le parascolaire, c'est plus que les sports, ça inclut même les sorties publiques. Mais je pense que ça va faire du bien aux jeunes. C'est plus facile un peu dans les écoles d'avoir un cadre qui est bien contrôlé, donc les consignes bien respectées dans les écoles. Et on va aller plus loin que ça. On va poursuivre dans les prochains jours les discussions, entre autres avec les fédérations sportives, avec la ministre du Sport, Isabelle Charret. Puis on vous promet la semaine prochaine d'arriver avec un plan complet de déconfinement progressif dans le secteur du sport qui est tellement important pour la santé mentale de tous les Québécois, mais en particulier chez les jeunes. On va aussi continuer de travailler sur les salles de spectacle, les lieux de culte, pour voir dans les zones rouges ce qu'on est capable de faire, mais on veut voir les impacts de la semaine de relâche. Cette semaine, là, il y a une grosse inconnue. Est-ce que les consignes vont être respectées ou ça va être comme dans le temps des fêtes? On va être capable de voir ça la semaine prochaine, puis donc être capable, avec ces données-là, de vous revenir là aussi, puis on espère être capable, dans les prochaines semaines, d'ouvrir les salles de spectacle. Donc, préparez-vous, les théâtres et autres, et aussi permettre d'avoir plus de personnes dans les lieux de culte. Là, je sais que c'est important pour beaucoup de personnes. Il y a quelques autres sujets dont je veux parler, dont j'ai beaucoup entendu parler dans les derniers jours. Entre autres, les masques pour les enfants première à 4e année. D'abord, vous dire, dans les zones oranges, ça commence en 5e année, les masques, mais dans les zones rouges, ça reste les masques pour tous les enfants du primaire. Bon, j'ai entendu toutes sortes de choses. D'abord, le Québec n'est pas le seul endroit à exiger des masques pour les enfants plus jeunes. C'est le cas en Ontario, c'est le cas en France, c'est le cas à beaucoup d'endroits dans le monde. Il y a des gens qui n'aiment pas que ce soit un masque d'intervention, un masque de procédure, plutôt qu'un couvre-visage. Pourtant, ce qui est important de dire, d'abord, le masque de procédure est plus efficace. Deuxièmement, pour les enfants, il est plus confortable. On a fait faire des masques qui sont à la taille des visages des enfants plus jeunes. Dans un masque de procédure, on respire mieux que dans un couvre-visage. Puis, moi, je crois, ce que la santé publique dit, là, ça aide à éviter la transmission et, évidemment, je pense qu'on souhaite tous qu'il y ait de mieux, puis que la sécurité soit la priorité pour nos enfants. Donc, dans les prochaines semaines, on se retrouve un peu comme dans une course contre la montre où s'opposent d'un côté les effets de la relâche, les effets du nouveau variant britannique, puis de l'autre côté, bonne nouvelle, la vaccination. Donc, c'est tout ça qu'on essaye de voir. On va avoir 800 000 doses, en tout cas c'est confirmé par le fédéral durant le mois de mars. On continue à accélérer. D'ailleurs, je vais en profiter, Christian le disait hier, pour remercier les pharmaciens qui vont nous donner un coup de main à partir du 15 mars. Bonne nouvelle aussi, puis je veux féliciter la santé publique, la fameuse deuxième dose. Hein. Vous vous rappelez qu'il y a eu beaucoup de critiques parce qu'on a choisi de reporter la deuxième dose pour qu'il y ait plus de gens qui aient une première dose. on était un peu seul dans cette école de pensée, mais là, la Colombie-Britannique puis le Canada disent maintenant, non seulement on peut attendre 3 mois, mais même 4 mois. Donc, on achète ça, nous autres aussi. Mais ce que ça veut dire, là, c'est bravo à la santé publique, la décision, c'était la bonne. Puis là, ben, les autres prennent exemple sur le Québec, on n'aille pas ça. Les régions, j'ai entendu des personnes dire, parce que dans la première semaine, on a donné 100 000 doses à Montréal parce qu'il y a une situation qui est particulièrement difficile. D'abord, c'était juste pour la première semaine. Puis on s'assure là qu'il y a une répartition équitable. Puis pour moi, là, c'est non négociable. Là. On va traiter de la même façon les gens des 17 régions du Québec. C'est sûr que quand il y a une éclosion, puis on pense à un endroit qu'il y a plus de besoins, on va aller selon les besoins. Mais l'équité entre les générations, pas entre les générations, entre les régions, c'est non négociable. Donc, c'est bien clair de ce côté-là. Bon, une autre chose, j'ai entendu, avec raison, il y a des personnes âgées qui ne peuvent pas sortir de chez elles. C'est sûr que là, ce qu'on essaye de faire, c'est de vacciner le maximum de personnes. Donc, faire de la vaccination de masse, c'est plus facile de faire venir les gens au stade olympique ou dans des salles, puis d'en vacciner le plus possible à l'heure. Mais on est déjà en train de préparer pour, dans une deuxième étape, aller à la maison pour les personnes qui ne peuvent pas se déplacer. Un mot aussi sur le travail des députés. J'ai beaucoup parlé avec les députés au cours des derniers jours. Les 125 députés à l'Assemblée nationale, là, tout parti confondu, n'ont pas un travail facile à faire. Il y a beaucoup de critiques. Hein? Je ne vous apprendrai rien en vous disant qu'il y a des gens qui sont vraiment tannés, écœurés des mesures, puis qui se défoulent au bureau des députés. Donc, je veux remercier les députés, puis tout le personnel des bureaux des 125 députés à l'Assemblée nationale. Merci pour le travail que vous faites patiemment, d'expliquer le pourquoi des consignes à tous vos citoyens. Une dernière chose que je voulais vous dire, c'est, bon, il y a des gens qui vont dire, bon, vous nous dites, il y a encore quelques semaines difficiles devant nous, soyez patients. Il me semble qu'on a entendu ce disque-là souvent depuis 1 an. Il y a quelque chose qui est différent, c'est la vaccination. C'est que dans le passé, ce qu'on disait, c'est les mesures vont permettre de réduire le nombre de cas, puis on va pouvoir déconfiner tranquillement. Donc, il fallait compter sur la collaboration de tous les Québécois. Là, la vaccination, mais c'est du concret. C'est comme une arme, là, où c'est sûr qu'on va gagner avec la vaccination. Il semble y avoir un grand pourcentage des Québécois qui acceptent de se faire vacciner. Puis une fois qu'ils sont vaccinés, après 3 semaines, ben il n'y en a pas beaucoup de risques d'attraper le virus. Donc, on est vraiment au bout, on voit la lumière au bout du tunnel, mais il reste encore un petit bout à faire. Mais la lumière est vraiment là. Et ça serait plate qu'on perde après 1 an d'efforts parce qu'on refuse de faire des efforts dans les dernières semaines. Donc, moi, ce que je veux vous dire, c'est d'abord merci pour votre patience, votre résilience. Puis moi, je suis convaincu qu'on est capable, dans les prochaines semaines, de gagner, mais pour ça, il faut gagner ensemble. Donc, merci tout le monde. Good evening, everyone. We've seen a decrease in new cases and hospitalization for a few weeks, but over the past 10 days, it seems to have stabilized. And we fear that it could start to increase again, especially with March break and with the new British variant. The vaccination is going well, but we still have a few critical weeks ahead of us. We have to stay very careful, especially in the Great Montreal. I'm announcing that starting next Monday, capitale nationale, Chaudière-Appalaches, Mauricie, Estrie, Centre du Québec et Laurentides will turn orange and will now allow up to 100 people in places of worship in orange zones. But I want to be very clear, gatherings are still forbidden. For Montreal, Laval, Lanaudière, Laurentians, and Montérégie. I'm sorry, in the first group, Laurentian is not there. It's in the second group. So Montreal, Laval, Lanaudière, Laurentians, and Montérégie. Public health authorities tell us that there will be an increase in new cases and hospitalization in the coming weeks, so we must keep these regions in red zone. I also want to talk about sports. I know how important it can be, especially for young people, but we have to understand that some sports can bring contagion. We have to stay very careful and move very gradually, but we should be able to lift some restrictions in the next coming weeks. I'll start, it will start with sports at schools, which will be allowed from March 15, and we'll announce a reopening plan for sports next week. So we're still in a race against the clock. On one side, there are the variants and the effects of March break, and on the other side, there's the vaccination. We definitely see the light at the end of the tunnel, and if we stick together, we can win. I thank you all for your patience, your resilience over the past year. We'll soon get out of this together. Thank you.
Merci beaucoup. Donc, on va débuter la période de
Thank
questions.
you. We will now start the question period.
Et à distance, pour celles et ceux qui sont présents virtuellement, veuillez s'il vous plaît lever la main sur l'application. On va prendre une question, une sous-question par journaliste. On va débuter en ligne avec Claudie Côté de TVA Nouvelles.
Alors, ma question est pour vous, Monsieur Legault.
My question is for you, Mr. Legault. What are the risks that we might have to go back in the upcoming weeks in terms of going to orange? Well, we have to understand that we have a period of about a month ahead of us that is going to be risky, because vulnerable people is going to be the period in which they are going to get vaccinated. So if there was to be a deterioration, we have a little bit of leeway in the new zones that we are putting into orange. But why are the other zones staying red? Because there is no leeway. So we're comfortable with today's announcement. Of course, those who are going to orange are going to be happy, but there are, unfortunately, that we have to keep in the red zones. We believe that it is a risk that is very well calculated. You said that you predict that in certain areas in Lanaudière and Laurentians, an increase in the number of cases as well as an increase in the number of hospitalizations. I'd like to hear you on that. For now, the results are pretty favorable. So what are you predicting? How many cases? What is the information that we might not yet know? If I may answer, Mr. Premier, we have to see that the projections that we've had have a big confidence interval. But first, what is going to help us is that it's clear that in the red, taking into account the variants and the outbreaks in those areas, we know that there have been variants in outbreaks in school settings. What will help us is that there's an entire series of measures, and I want you to understand that there's a series of measures that are still being maintained. And I think that with the screening and contact tracing capacity and in controlling the outbreaks and in respecting the guidelines that we've given, we have a curfew still, and that's, there's a good reason for that. It's to avoid community transmission and gatherings. We have, getting together in people's homes is still forbidden. Working from home is mandatory where it can be done. Those are all things that allow us to control that transmission. And we believe, because when the variants come in, there is an increase. But as the Premier was saying, it's a question of delaying all of that with a significant quantity of vaccination. That is where the issue is. The period, I would say, is critical, because if we lift too many restrictions before people get vaccinated, things are going to go up too quickly. But if we are rigorous and still keep applying those measures, even the impact of spring break, for which we have concerns and other people have concerns, if we maintain the other situations in place, we will be able to, I believe, to still be in control. But we'll see the number of cases, and what is important is to respect all the guidelines. so that rather for it to go up sharply, it'll go up gradually.
Bonsoir à vous trois.
Regions such as, for example, Lanaudière or Montérégie are very large regions. They are all in red.
Évidemment que la situation, par exemple, je prends à Montérégie, à Longueuil, est peut-être plus inquiétante qu'à Saint-Cyprien-de-Napierville. Pourquoi ne pas avoir créé des sous-régions, comme ça s'est vu, par exemple, au printemps, par exemple, dans la capitale nationale? La capitale nationale avait une couleur, Charlevoix en avait une autre. Pourquoi, là, vraiment, on y va à la grandeur des régions, à la place d'y aller vraiment là où il y a des problèmes?
Bien, je peux peut-être commencer en disant, quand on regarde d'abord de façon détaillée les sous-régions, on voit, exemple, dans les Laurentides, la sous-région qui est la plus affectée, c'est Antoine-Labelle, là, dans le coin de Mont-Laurier, dans le nord. Quand on compare la Naudière-Nord et la Naudière-Sud, il n'y a pas une grosse différence. Quand on va dans Montérégie, on voit que ce n'est pas nécessairement à Longueuil que c'est le pire, mais c'est plus dans le coin de Richelieu. Donc, c'est pour ça là, que... Puis en plus, ben, il y a une autre raison, c'est que les hôpitaux de ces régions-là desservent l'ensemble des régions. Donc, si ça va mal, puis déjà c'est serré, mettons, dans la Naudière, à Joliette, à Terrebonne, ben, c'est les deux hôpitaux qui desservent toute la région. Même chose avec Saint-Jérôme, Deux-Montagnes, dans les Laurentides. Si on prend les hôpitaux dans Montérégie, c'est la même chose, ils desservent une immense région. Donc, c'est difficile de découper les régions sans tenir compte des grands hôpitaux de ces régions-là.
Et puis, on comprend que la semaine de relâche, on pourra évaluer les impacts, vous dites, la semaine prochaine, et qu'à Montréal, c'est les variants qui font en sorte que la situation est critique. Qu'est-ce qui vous démontre que la situation des variants ne va pas dégénérer ailleurs au Québec dans les prochaines semaines?
Knowing that people are moving around, there are people in Montreal who went to other regions of Quebec during the spring break. So isn't it a little bit premature to have those announcements today? Well, I'll start and then I'll let Christian continue. Well, I had a presentation made to me of the different regions on Saturday last. And as I was saying earlier on, there are doctors. I don't remember all the doctors, but there were many who were involved in the projections. So we take into account an evaluation of the effects of the spring break, an evaluation of the effects of the increase of variants, but also to counterbalance the effect of the vaccination. And all of that mixed together in their projections for the following weeks shows that there is a stabilization and some leeway in the first regions, such as Quebec, Chaudière-Appalaches, but that there is an increase that is projected, for example, in Montreal in the upcoming weeks. So they did a very detailed evaluation. Maybe Christian could add something to that. Well, the only point that I wanted to add is that, as we do every week, those documents will be available as of Thursday morning. So whether it be the simulations, the Dr. Brisson that you were talking about, the analyses that he's made over the past few months, many people have seen it. So tomorrow morning at the same time as the results by the INES that makes an update on hospitalizations, well, those documents will be available to you tomorrow morning. And that is where we can see really how little leeway we have in the Greater Montreal area, whereas that leeway is present in other areas of Quebec. So those are all the simulations that have been done and redone over the past few weeks, and they take into account many different factors, and that will be available tomorrow. I would also like to add that we are relaxing some measures, but we're not lifting them, In Quebec, we have relatively strict measures compared to other areas elsewhere. Gatherings are not allowed. We don't want people. We want people to keep working from home. We want people to have physical distancing. We want them to wear the mask. We're adding the surgical mask in schools because there are variants circulating right now. So we want to protect the children and their families. So it's not, a lifting. It's a series of measures that we still have. The variant is there. What we can do in public health is to act quickly And if you have symptoms, to go get screened in order to not contaminate others. And third, we have to respect all the other guidelines. With that, we can relax things somewhat, and we also can respond to people's mental health distress by adding activities that have a lower risk for the transmission of the virus. Tomorrow morning, there's not going to be hockey games, although everybody would love to see them. I'm sorry, Mr. Premier, but it's not tomorrow morning that that's going to take place. We have to go progressively. And the epidemiology outside of the metropolitan area is different. It gives us more leeway, and there is nobody who can guarantee that they won't go back to red in those regions. That's also important to keep in mind. And that is why we have to give a little bit of oxygen, a little bit of air, if you will, but it's not, a total lifting. And I really want to insist on that. Each citizen has a role to play. If you have symptoms, if you think you were in contact with somebody, go get screened. We have capacity to do that. We have room. And it is major that you respect the guidelines that are given. The other element that I want to give you is we're going to be vaccinating a lot in March. So much the better. But once you're vaccinated, you're not protected immediately. It's an excellent vaccine. You will be protected, but you could still transmit the disease to others, and that is why you have to keep the mask, the distancing, and all other guidelines. And I want to say it because I don't want you to think that today we're lifting everything. We are just relaxing a little with a calculated risk. We cannot allow ourselves to do the same thing in the Montreal area as in the rest of Quebec. I know that it takes a long time for me to say all this, but it's important that people understand that balance, that bridge and the end of the marathon, that is what is going to prevent us from having to go back and to waste all the efforts that we've deployed since the beginning.
Bonsoir à vous trois.
Bonsoir.
Laval, Laurentides,
Laurentians, Lanaudière, Montreal, Montérégie, that represents over 4 million people. It's pretty much more than half the population of Quebec. The people, Mr. Legault, that you've asked over the months to make effort during the holiday period, and then it was to continue another month of February, and then it was, the spring break that you feared, and every time you showed the possibility of lifting restrictions, notably after spring break, but for those 4 million people, there's almost nothing, no lifting of restrictions. Do you feel a kind of, people are getting really sick and tired of it, and that those citizens might not trust you as much when you have something shimmer to them, and but that they might not believe it? Well, if we're talking about red zones, we're going to start with extracurricular activities again. So as of the 15th of March, sports in school. And secondly, next week we will be announcing some relaxing of measures in sports. But now the British variant is unfortunately present in certain regions. And there is a real risk of having a third wave. So we don't have the choice right now. And I understand that people are tired. We're all tired. But at the same time, we have to be able to remain prudent. We don't want to end up in the situation that we had in January in our hospitals, and we do not want to continue having to postpone surgeries and treatments in our hospitals in the Greater Montreal area. So that is why we're prudent. It's not for the fun of it. And listen, the variant, a few months ago, nobody was talking about that. But we've opened up certain activities for the spring break, and we're leaving them open, so whether it be skating rinks, municipal pools, cinemas, so there's been efforts made, but nobody can do the impossible. And the percentage that you're talking about, the region that we are talking about today represents an increase of 30%. Remember, when we made the last announcements, we said that we had 10% of the population of Quebec that was in orange zone. We're going from that to 40%. So people who have respected and who have made the efforts, well, we can change things now. So that is 30% of the population. That's I wanted to bring that clarification. For the curfew, you'll agree with me that that is one of the most constrictive aspects of the measures that have been set up. There are people who are starting to find that 8 p.m. is pretty early. The sun is up a little bit later. The spring is coming. We're going to change the hour soon. The variant is present everywhere in North America, but there's pretty much only in Quebec where we have a curfew. So for the red zones that are going to remain in red for the following weeks, are people to understand that as long as we'll be in red zone, the curfew will be 8 p.m.? Or could you go more gradually over the weeks and, let's say, delay the curfew slowly, even if we're still in a red zone? Well, listen, it will depend on the evolution of the variant and the effects of the spring break in the following days. It's difficult to be able to predict exactly where we'll be. We know that we have a few difficult weeks ahead of us, and after that, the vulnerable people will have been vaccinated, and then we'll be able to remove the curfew. But for the time being, my priority, what I've heard, is that we have to open up sports. Now, we're opening it up a little bit with extracurricular activities next week, and I hope that we'll be able to open a lot more. But we're talking here a lot about sports. And as Christian was saying, we have 40% of Quebecers who will have a curfew at 9:30 p.m. rather than 8 p.m. So we are, evolving, but there's still a few weeks. There's like a block of 2 to 4 weeks that is going to be difficult ahead of us. I'd like to ask a question that all Quebecers dream of asking, a question that is burning the lips of everybody. Mr. Arruda, are the new measures announced today by Mr. Legault correspond to your recommendations? Yes, quite. Because it corresponds to our recommendations, and I wish to say, just for example, the directors of public health were absolutely not for the segmentation of the territories because it would have created problems of a significant nature. Prudence in red zones was, fought for very intensively by the Director of Public Health of the Laurentians area, Lanaudière, Montreal, Laval, Montérégie, and I believe that we had also agreed, while knowing that there was a potential risk, but much lesser in the orange zones, it really made us, be prudent, but we were all along the same wavelength. And it's not to penalize the metropolitan area that we're doing this. We all have many concerns with mental health, the elderly who have been isolated longer. But I believe that, as the Premier was saying, and my Minister, it is our vaccine that is going to allow us to take the exit door. Mr. Legault, I would like to follow up on the critics. You talked about, the 10,000 people who you trained. That was a pride, and the army and all that, as well as the saga of the masks. There's a lot of critics. I don't want to accuse you of rewriting history, but wasn't it a little bit early to go over those results, Mr. Legault? Well, you've asked a great deal of questions. The army, we had 1,000 soldiers out of 21,000 people who came with Je Contribue. The mask, we followed the recommendation of public health. The 10,000 workers that we were training, we have 800 who are being trained right now. It changed things quite a bit. There's some who are ill, some are working. There were no bosses in many CHSLDs. Now there is one boss in each CHSLD. So, and when we compare the results of the second wave with the first wave, well, it's day and night. Now, what I was saying over the weekend is that vaccination, and we were scared at one point when we saw in February that the deliveries of doses were being delayed. We were worried, but now we've been reassured. Last week we were told that we were going to be received doses that were planned as of the 31st of March, and that will completely change the portrait of the situation in Quebec, those doses. So, yes, we still have a few weeks left before vulnerable people all be vaccinated, but now we have the confirmation that we will get the doses. We've had the confirmation that it's a good idea to give just one dose, to have as many people as possible that will be covered. So I can tell you that as of now, we're working very, very hard on the new economy, because in the upcoming months, we're going to start up very quickly in Quebec once we'll have gone through the following weeks of vaccination. So I am very optimistic, and I can predict an economic boom by the end of 2021.
On va passer à Charles Le Cavalier du Journal de Québec.
Oui, bonjour, M. Legault, M. Arruda, M. Dubé. Pourquoi ne pas faire passer cette
Why
comme la Gaspésie?
not have certain regions like Gaspésie and Côte-Nord to yellow? Over there, there's almost no cases left. The question is pertinent because we've had discussions with directors of public health in those regions to be able to perhaps review over the next few days whether we couldn't. Probably a yellow that would be different from the former yellow because of the risk of variants, but these are things that we are evaluating as we speak. For the time being, it has to be understood that with the context of the variants and the spring break, we wanted to be more prudent, and we found that already transforming many zones from red to orange was an important step to take. You know, there are people that we do too much, that we're going too quickly. Some people find that we're too slow. I think it's a question of being prudent, but it is something that we are evaluating. Also wanted to know for restaurants in orange zones, if I'm not mistaken, there's 2 adults that can go to the restaurant from 2 different addresses. Why can orange zones go to the restaurant with a friend, but we can't have them over at home? Well, there's a context where I believe that in a restaurant, it's true that you can be close, but there's a context that is very different from home. Distancing between the tables, serving, and all that, whereas home it's easier to actually go into gatherings. And it's also a way, I would say, for certain people to give them a way of escaping. You know, eating at the restaurant can be good for that. And if you're 2 adults and you have your children, you can also go if you come from the same family bubble. So we're evaluating that when things are well respected and when they're well done, the risk is lesser in nature. Whereas what happens in people's homes, and it's normal, you know, we're at home, the probability of having contacts, you know, preparing the meal, for example, too close together, well, that brings a higher probability of risk. I would like to know how you're going to convince people to take the AstraZeneca vaccine that doesn't protect them as well. I'll start and then I'll hand over the mic. In principle, the vaccines that are offered to us, it's with the recommendations that come from the SIC, the Immunization Committee of Quebec. So they're all good vaccines. I think that we don't have the means right now to not consider 100,000 extra vaccines when we're having a hard time vaccinating people because we don't have enough. That's one thing. So it's a good vaccine, AstraZeneca, and I would tell you quite simply, we've talked about it over the past few hours. I'll give you my example. If I was being offered, you know, if I was in the age category where it would be offered, I'm ready to take that vaccine. It's very clear. I think that we are lucky to have an extra 100,000 vaccines. So at a moment that is important for us. So with public health, we will find the correct category of people, but I can tell you that I would be ready to take it to show the example, because it is important that we be able to take advantage of an extra 100,000 people to vaccinate. But maybe Horatio would like to say something? That vaccine has been approved. It corresponds to the minimal criteria, a lot more than the minimal criteria of the World Health Organizations. Vaccines are all different, you know, they're not the same technology, they can bring different protection, but what is important is that it's an efficient vaccine that is going to prevent the serious forms of the disease and hospitalizations, and is going to save lives. As our minister is saying, we don't have the luxury right now of letting people die with an efficient vaccine. And myself personally, I also want to say that if I'm in the category to receive a vaccine, I would not recommend a vaccine to the Quebec public that I wouldn't take myself, and I think that's very important. Also, let's wait for the studies that are being made elsewhere in the world, which seem to show an efficacy that is increasing compared to the clinical effects, particularly in people who are older, because very often these are groups that have fewer individuals. So we would not recommend, and the Quebec Immunity Committee would not recommend a vaccine that is not useful for the Quebec population. I would like to know how you're going to pay the pharmacists that are going to be participating in the vaccination effort. The agreement that we signed over the past few days, which is similar to the one that we had for influenza last fall, and I'll give you an approximate number. It's about $30 million for 2 million doses that we're going to get. So it's the federal government that pays for the vaccines, but for the vaccination itself is $30 million for 2 million doses. Hello to all three of you. For my first question, I would like to get back to a subject that has already been evoked by my colleagues. Up until now, you were saying that we're going to see the effects of a new health measures or an event 2 weeks after. But you're making a decision now for after the spring break without having seen the effect of the spring break on the epidemiological situation. What has changed? Are you now able to predict ahead of time how the spring break, what kind of effect it will have had? Well, sorry to have to wait for tomorrow morning because I would like to be able to present you the graph now. It would be easier if I could show it to you right now. But we really have two different regions, the Greater Montreal area and the rest of Quebec. And as the Premier said earlier on, and you'll be able to see it in the studies tomorrow morning, the leeway that we have in the rest of Quebec, that is to say that even if there were a few variants, even if people didn't follow the guidelines as much, in the rest of Quebec, we can take that there's more leeway. But in Montreal, if the measures are not followed correctly during the spring break, as we get more variants in Montreal over the following weeks, we simply don't have that leeway. And that is why we're looking at that and keeping it simply. And you'll see these simulations that were ordered by the NSPQ and conducted by the same doctor who made the studies in the past few weeks. That is what explains the fact that despite a negative potential of the spring break or the variants, we do have the leeway to make the decisions to go to orange zones in the 6 zones that the Premier mentioned, but we don't have that in the Greater Montreal area. For the regions that are remaining in the red zone, you said that we should expect to have an increase of cases and hospitalizations. The worst scenarios, according to the scenarios, does that make it that hospitals could be overwhelmed, that there could be a loss of control over the situation? Well, one of these scenarios with a percentage of probability that is pretty reasonable would make it that at the end of March or mid-April, we might end up once again with 2,000 to 3,000 cases per day and with 1,500 to 2,000 hospitalizations as we had in January. Mr. Dubé, I'd like to ask you to show us your projections, if there are any, on the transmission of the variants. The regional director for public health, Dr. Drouin, said earlier on today that last week, 12% of positive cases were associated to variants, or rather 2 weeks ago. Last week it was 15%. According to the evolution of the situation, when should we expect to see the variants of coronavirus become the dominant strain in Quebec? I will let Dr. Arruda start, and I'll complete if necessary. Depending on the measures that will be set up, the percentages of variants can double in 2 to 4 weeks, thereabouts. the more we apply restrictive measures, such as we have right now, the more we spread this out in time. But it is clear that in the midterm, we will have at some point, it is the variant that will be the main strain. So I believe that it's difficult to tell you exactly at what time it will happen. It really depends on how we are able to limit the spread of that variant. What's clear is that at some point, if the virus behaves as it has elsewhere, it will replace the main strain, and then we'll have, but by that time people will be vaccinated, which will help prevent the strain from replicating itself. I understand that you don't have projections, and correct me if that's the case, but I will still go to my next question. Mr. Dubé, we have learned that the National Committee for Immunization is recommending to delay the second dose to 16 weeks after the administration of the first dose. Does that mean, first of all, that the elderly in CHSLDs who were vaccinating in December are going to have to wait until mid-April? And why take that risk, once again, of delaying the second dose? I really appreciate the question because I think it's important. The Premier mentioned it. On the first point, once again, I want to remind you the position that public health took a few months ago, which was a difficult one, to make the decision to delay the second dose up to 90 days, which is now only followed by British Columbia, but it seems to be the position taken by the National Institute as well in Canada. I think it's important to recognize that it was the correct decision. Secondly, it also has to be recognized that the reason why we're doing this is not just to have fun with it and to say we're right. In our case right now, what we want to do is to vaccinate as many people as possible, as quickly as possible, with the first dose. Going from 3 to 4 months, what we'll be doing now with the Canadian Institute that is recommending it and accepting it is going to give us 250,000 more people who will be able to be vaccinated. And that 250,000 people, that is within the 60 to 65 age bracket. It's major. So for the same reason as we did 2 months ago, we're now saying that everybody agrees that we can go up to 4 months. And we'll take advantage of that because we can. Because we still don't have as many vaccines. And if we can have 250,000 people more with the first dose, which is the most important. And thirdly, what we've decided to do, and we've been doing it by exception because it's important for us, for people of the first 2 CHSLDs that have been done, that is Saint-Antoine and La Monnaie, which were pilot projects. There were people who had accepted being vaccinated. You remember the 14th of December. We're talking about 400 people. They will get the second dose because the appointments had already been planned on for the beginning of next week. Everybody else don't need to call. We will call them back and we will adjust the appointments consequently because we believe once again that is the correct decision to make, and I recognize once again the effort and the leadership of public health who made that decision. I was wondering about the opening of dining rooms in RPAs. Will it be as planned in orange zones? And what about the opening of spas? They were asking to be able to be opened in orange zones. That is part of the discussions that are ongoing right now because, as we said, there's sports, which is a priority for mental health and for our elderly as well. So right now we're talking about it. We're adjusting things. Once again, these are things that are going to be clarified next week. There's going to be a lot to do next week, but it will allow us to go progressively. Of course, what is happening in orange zones, it helps out a lot, it relieves people, but there are people who are alone, isolated, who don't have access to a dining room. And if there is a reopening of any reopening, it's going to have very strict protocols to avoid any other outbreaks. And thank goodness with the vaccination of those areas as well, you know, we have to wait 3 weeks, but people will be protected. So there's a lot of hope in those areas for the upcoming days. Okay, but in orange zones, the dining rooms of RPAs are opening as planned in the protocol, yes. Okay, my follow-up concerns the date at which we will review what is being announced today. So these slackening, how long are they for? Is this honeymoon going to be very short since we're not excluding going back? Well, everything will depend on the epidemiology that we observe. As I said, you know, when you look at the projections, you have a line, you have a confidence interval that is pretty large sometimes. So it's difficult to say, are we going to go be above or below it? It can make a big difference. But I think that what we're saying is that it's always based on the epidemiology, the risk in orange zones of going down in the situation, and to have things take off very quickly is much lesser than in a metropolitan area, and that is why we are adjusting. But if things don't go as well, I'm sorry, Mr. Premier, of course we'll be able to come back. We're not going to let things deteriorate. And maybe the point that I would like to add to that, because we'll have the benefit of being able to talk about the models tomorrow morning with those that we're going to be talking about it, I would like to say that the question of the variants, if we look at the positive aspect, we are able to control the variants as well. We've shown it. For about 2 weeks, the variance that started at about 5% of positive cases, it oscillates between 10 and 15% of positive cases. What we're scared of is that it will come too quickly to 30, 40, 50%, so what we call an exponential increase. Up until now, and I have to congratulate the people from the Greater Montreal area, because as much in Laval as in Montreal itself on the island, they have succeeded in controlling that evolution of the variants through measures with contact tracing that is even more significant, where we ask the contacts of contacts to isolate themselves. So we're even more severe in the tracing and confinement of people who are contaminated. So that is why we're saying, yes, there is an uncertainty on the variant aspect. Everybody understands it. They're more virulent. They can bring about a more serious form of the disease. But that is where we have to be able to contain them. And in the simulation that you'll be seeing tomorrow, we can see that it is possible to contain them. But all of that depends on the health measures and of the follow-up that will have been made during the spring break. So we can't see that as being only negative, to see that it is one unknown, but we can control it. And Montreal, up until now, has shown it.
On va passer à Mylène Crête du Devoir.
Bonjour.
I would like to know the doses of the vaccine AstraZeneca. Who are they destined for? Which age bracket? And what will you do to use them before the best before date, which is in April? We're waiting for a notice by the sick that is going to come in. Yeah, it's a question of hours, so that we can have a look at what they recommend to us, whether they recommend it to people older than 65 or certain other categories. Of course, that vaccine, since it has, it's easier to transport as such, is probably going to be used in situations where we couldn't have used Pfizer, and perhaps in people's homes or elsewhere. But taking into account that we haven't received the CEQ, the National Institute will wait before we make the final decision. But that's good news, because it's a vaccine that will allow us to go to places where we couldn't have gone before and to protect more people. My second question, Mr. Legault, I would like to know, as far as the show venues are concerned, even if there is a reopening in orange zones, while respecting health measures, of course, will the measures of health that were destined to theaters, and so are they going to continue anyway? Because it can take longer to organize new shows, under the circumstances. I was wondering. Well, there are two groups of measures. There are some that come from the government of Quebec. Those are going to continue, and there are measures that come from the federal government, and that, the question would have to be asked of the federal government. But I'd like to remind you that one of the reasons why we've waited is that if we, for example, look at Montreal. As of the time, if we have a curfew at 8 p.m., a lot of theater rooms and show halls are saying, well, it will not be profitable to have shows only in the afternoons. And people think that, yes. So as of next week, we'll be able to announce dates so that they can get ready. It takes longer to get ready, but our intention is that as long as those rooms are not in a profitable situation, we will be helping them out financially. One last question before going to English. We spoke a lot about variants in the Montreal sector. I'd like to bring you to the Abitibi-Témiscamingue area where there are 40 cases detected by sequencing for the South African variant. Is that a situation that concerns you, and will that change the prioritization of vaccination? You talked earlier on that you would, you said early on that you would go along with need. Well, Abitibi is really experiencing a very specific situation. It is a zone, with the South African variant where there was an import. We're keeping a very close eye on that. There was proactive crippling screening to see about the outbreaks. The outbreaks right now are under control, so that strain could quite simply end up, fizzing out. But we're following it very closely. We have to understand that right now, the Abitibi doesn't have a higher rate in a very exponential way compared to others. And I think that if ever it were the case, we would see it. But I think that right now, Abitibi is controlling its situation. And what we'll try to see over the following days is how it's going to behave. Is it going to increase? What is going to be the percentage of the crippling kind of screening? And we'll make the decisions to know whether we should go to another color or anything like that. So we're keeping a very close eye on variants in general. But we also have to be able to see that, taking into account the population and the context, very often it's a lot more isolated in terms of transmission compared to, a big metropolitan area with a very large population. Mr. Legault, you barely talked about the subject of mental health earlier on. Some people have been experiencing with a curfew, isolation, in a red zone, they have a certain level of distress and stress. What can you tell them directly, since they're listening to you right now? Well, listen, we are trying to say, people who are alone have the right to have one other person alone visit them. We've tried to go towards outside activities. But, at some point, we still have to understand that with the British variant, contagion is very dangerous. The situation that we're still experiencing for a few weeks up until people who are vulnerable are vaccinated. So I was saying, the element that bothers me the most is sports. It's to say young people, amongst others, who are used to doing sports, and even older people, it's a way of getting rid of stress. It's a way of keeping a life balance. But we can see, even in hockey, with all the money and the precautions that they have and that they take in the National League, we were seeing, Sidney Crosby, who caught COVID-19. So we have to be prudent. It would be great to be able to say, we're going to start with hockey games for peewees, but we have a maximum of one difficult month ahead of us. I understand that it's an accumulation in the past year, but we're not going to purposely expose people to catch this virus, which has serious consequences. We'll now switch to English.
Good afternoon. How are you going to control people from red zones going into an orange zone to, for example, say, go into a restaurant?
Well, as we said, we don't plan to have a specific road control more than because it has not been, but we'll have spot checks, we'll have the VP Prime Minister Premier will make sure that we have those controls in place, but we don't expect to do more than what we have done so far when Abitibi or other region turn to orange. We rely on people making sure that they they stay at home as much as possible because we don't want to impose more than that for now.
Okay, perfect. How long do we foresee red zones to remain in red, and what would be the criteria to change the colors?
Maybe to answer your first and your second question, the curfew is very important in red zones. It means that you may go and visit somebody or even go to another regions, which is not the best idea, but you have to be back at home at 8 p.m. Right now, we expect that over the next month, we'll be able to vaccinate vulnerable people. So I think that that's the time line for now, to say after the vulnerable people be vaccinated, be a lot easier. It'll be a a new ball game.
Thank you.
We'll go with Iman Kassam from CTV.
This is going to be a test of my translation skills. So, from what I understand, and what you just said, so when vulnerable people are vaccinated, then it'll be a lot easier on us in the Greater Montreal area. We can start seeing some restrictions lifted. But you also said it'll be a few weeks, maybe 3 to 4 weeks, until vulnerable people are vaccinated. So it's kind of a two-part question, because it's, why the delay? Why can't we vaccinate vulnerable people faster? And second, how is the plan to vaccinate people at home for people who are less mobile? How's that going? And I kind of see them connected.
Okay. Well, first, I repeat my two figures. 80% of the death are people over 65 years old. 95% of people in our hospitals are people over 65 years old. So it's clear that once these people are vaccinated, it's a new ball game. So now, we use all the doses we receive. So to go faster, we would need more doses. And that's why I'm very anxious also to see what can we do with the AstraZeneca doses. We would like to use them. But of course, we want to make sure that it doesn't have negative impacts on people. So we must receive those indications in the next few hours, but we want to use these doses. So in order to vaccinate faster the people of 65 years old and more, we would need more doses. But with the confirmation we have right now, we think that within the next month, we'll be able to do so.
Cool. Okay, thank you. A lot of emphasis today on sports. Am I to understand that the sports that are starting up in schools on March 15th, that includes Montreal region?
Yeah.
Yeah.
Everywhere, red and orange, sport at school. We think, and the public health think also that we can put measures that will permit us to have these sports in schools.
Okay.
I may add also that for people who can be anxious about this, it's going to be activities on besides school, which the same group, okay, the same bubble group from the class. So that will not make more contacts of different persons together. So the Ministry of Education is planning that in a way that if you're going to do sports, you're going to do sports with the same bubble of your class and not mixing up different classes, which could have been something worries for parents.
So, my actual question, was that, we're seeing a lot of responses from sports federations saying that we want to open. What are some of the determining factors you're going to decide? Obviously some sports are at higher risk than other sports, but maybe you can just explain what you're looking for, what will determine what sports can open and not.
I think, first of all, any sports augment the contact, but will go progressively, I would say. And there is different levels of risk of training. How many people are training in the room, the space of it. The playing tennis, for example, is different from having a hockey game. Matches are more contact. So this is going to be later. But at the same time, I would say that supervised sports by federations with good protocols could be acceptable. So it's going to be what is going to be announced next week, what are going to be the steps, and because we worked a lot, Ministry also of Loisirs et Sport, with the different federations to see the protocols.
And lastly, we have Lauren McCallum from CBC News.
Hello, good evening. I want to stay on sports here for a little bit because I'm trying to wrap my head around this. I listened to Montreal Public Health today, and they said 2/3 of the variant cases are being spread through schools, which is why you're asking even elementary school students to wear masks in class. How, then, do you justify having children running around in a room without a mask, because I'm assuming they're not wearing masks when they're doing their sports? I don't understand. Please explain.
It's you know, the risk zero doesn't exist. The issue is that we want to balance things. You know, kids can have problem if they get stressed, if they don't get, you know, even they can have impacts on their learning capacity. So it's clear that we are balancing the risks in that situation, because if we want no risk, we would close schools, we will all go home, and that would not be acceptable, you know. And if we want people to stay in, I would say, not perfect health, because it's very difficult actually to do that, we must take that. And we are adding, I would say, masks in primary school in red zones because of the variants, because the contact on those situations all the day with the class, the probability of contact is higher than this practicing of different sports. So that's the reason why, you know, because if we are too tough, we're gonna lose people, and and that's the risk actually, that people are tired of everything. We are balancing it and we are following it, and if there is a problem, we'll come back. But we think that the way we are acting, and I was telling it, we are not relaxing everything, we are going softly, and we still keep things that are here and not elsewhere. The curfew is an important issue. People must work at home, so all these things, and people, I hope, will wash their hands, will keep the 2 meters distanciation. People understand better now, and I would say, let's do that till we get most people vaccinated in Quebec.
Thank you. My second question is, and you've pointed it out yourselves, that we are expecting the cases in Montreal, where the UK variant is present and growing, to proceed up until at least for the next 4 weeks. What was also said by Montreal Public Health, that the transmission is happening of variants from school-age children into the households where parents live. Now, you've talked about vulnerable people, assuming that everybody who's vulnerable is over 65. Bear in mind, there are many people under 65, like parents with asthma, other diseases, chronic diseases, cancer, all that thing. So how then can you expect to prevent the spread of variants when you know these children will be running around without masks and coming home to their parents?
In fact, I would say I understand the preoccupation, especially when you are a disease, you're afraid. But the factor which is the most important to get hospitalized and die from that disease is age. Really, independently. But if you take a 50-year person, one which is diabetic and the other one not diabetic, the risk will not be the same. It's going to be higher for the chronic disease, but it's not at all as the one of the independently of the age. It's a very important issue, and the planning of priorities is made on relation to the risk of getting hospitalized and have the disease. So, and the issue is, I can tell you, and it's always have been that, if we had vaccine for everybody, we will do a big mass and vaccinate as most people must do. But now with this, I think, and we cannot, I think, actually stop society because of this. But vaccine, those equilibriums are things. And if the kid has symptoms, or if you can get tested and make sure you get isolated and protected. And I think if you are high risk, the most important thing is to take sure that you put your mask, you keep your distanciation of 2 meters, and you wash your hands.
Merci tout le monde, c'est ce qui met fin à la conférence de presse.
Thank you, everyone. This puts an end to the press conference.